Finasteride is an antiandrogenic compound that is used for the treatment of symptomatic benign prostatic hyperplasia, BPH, and male pattern hair loss in adult males by inhibiting type 2,5-alpha reductase. In this video, let's found. What is finasteride? What is finasteride used for? Contraindication. What are the side effects of taking finasteride? How does finasteride work? How to use finasteride? What is finasteride? Finasteride, sold under the brand names Proscar and Proscar among others, is a medication used to treat pattern hair loss and benign prostatic hyperplasia in men. It can also be used to treat excessive hair growth in women. Finasteride was patented in 1984 and approved for medical use in 1992. It is available as a generic medication. In 2020, it was the 90th most commonly prescribed medication in the United States, with more than 8 million prescriptions. What is finasteride? Finasteride, sold under the brand names Proscar and Proscar among others, is a medication used to treat pattern hair loss and benign prostatic hyperplasia in men. It can also be used to treat excessive hair growth in women. Finasteride was patented in 1984 and approved for medical use in 1992. It is available as a generic medication. In 2020, it was the 90th most commonly prescribed medication in the United States, with more than 8 million prescriptions. What is finasteride? Finasteride, sold under the brand names Proscar and Proscar among others, is a medication used to treat pattern hair loss and benign prostatic hyperplasia in men. It can also be used to treat excessive hair growth in women. Finasteride was patented in 1984 and approved for medical use in 1992. It is available as a generic medication. In 2020, it was the 90th most commonly prescribed medication in the United States, with more than 8 million prescriptions. Side effects. The most common side effects are dizziness, due to postural hypotension, upper respiratory tract infection, headache, fatigue, and abdominal disturbances. Side effects include stomach pain, heartburn, and congested nose. Adverse effects of finasteride are similar to that of tamsulosin, but with a 70% lower rate of retrograde ejaculation. Pharmacodynamic. Finasteride is an antiandrogenic compound that works by suppressing the production of serum and intraprostatic dihydrotestosterone, DHT, in men via inhibiting the enzyme responsible for the biosynthesis of DHT. The maximum effect of a rapid reduction in serum DHT concentration is expected to be observed 8 hours following administration of the first dose. 13 in a single man receiving a single oral dose of 5 mg finasteride for up to 4 years. There was a reduction in the serum DHT concentrations by approximately 70% and the median circulating level of testosterone increased approximately 10 to 20% within the physiologic range. Mechanism of action. Finasteride acts as a competitive and specific inhibitor of type 2,5-alpha reductase, a nuclear-bound steroid intracellular enzyme primarily located in the prostatic stromal cell that converts the androgen testosterone into the more active metabolite, 5-alpha dihydrotestosterone, DHT. DHT is considered to be the primary androgen playing a role in the development and enlargement of the prostate gland. It serves as the hormonal mediator for the hyperplasia upon accumulation within the prostate gland. DHT displays a higher affinity towards androgen receptors in the prostate gland compared to testosterone, and by acting on the androgen receptors, DHT modulates genes that are responsible for cell proliferation. Responsible for the production of DHT together with type I5-alpha reductase, the type 2,5-alpha reductase isozyme is primarily found in the prostate, seminal vesicles, epididymides, and hair follicle as well as liver. Finasteride works selectively, where it preferentially displays a 100-fold selectivity for the human type 2,5-alpha reductase over type I enzyme. Inhibition of type 2,5-alpha reductase blocks the peripheral conversion of testosterone to DHT, resulting in significant decreases in serum tissue DHT concentrations, minimal to moderate increase in serum testosterone concentrations, and substantial increases in prostatic testosterone concentrations. As DHT appears to be the principal androgen responsible for stimulation of prostatic growth, a decrease in DHT concentrations will result in a decrease in prostatic volume, approximately 20 to 30% after 6 to 24 months of continued therapy. It is suggested that increased levels of DHT can lead to potentiated transcription of prostaglandin D2, which promotes the proliferation of prostate cancer cells. Half-life. In healthy young subjects receiving finasteride, the mean elimination half-life in plasma was 6 hours, ranging from 3 to 16 hours. In elderly patients over the age of 70 years, the half-life is prolonged to 8 hours. Dose. Benign prostatic hyperplasia. Proscar, 5 mg p.o.q. day, assess response after 12 weeks to 6 months. Androgenic alopecia, men only. Propecia, 1 mg p.o.q. day for at least 3 months. Female hirsutism, off-label. 5 mg p.o.q. day. Safety advice. US FDA Pregnancy Category X, studies in animals or humans have demonstrated fetal abnormalities or there is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience. That's all the information about finasteride we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.